You're going to learn a little bit about things. You'll be able to ask questions as well. So if you have questions, please be an open and engaging audience, because that'll be way more beneficial for you all, and we'll take the discussion wherever you all need to take it, okay? There's a lot of content, so we're going to move quickly, but just to introduce ourselves, I'm Dr. Mike Russo. I practice out here in Orange County. We have 3 locations. I'm a weight loss specialist, bariatric surgeon, and cosmetic surgeon. So we do it all at my place. But we do a lot of GLP1s, so I'm really excited about this.
Hello everyone, my name is Janae, at @JaneeleesAnders on all social sites. I had my VSG on March 2nd of 2023, and then I started taking semaglutide in April of this year, and in total, with all the tubes, I've lost 123 pounds and counting.
Yeah, queen! Hello, I'm Stephanie Ristow, One Hungry Mother on Instagram, and you guys got my intro yesterday. I had weight loss surgery 3.5 years ago. I started a compound tirzepatide in January and hated it, which is why I'm on this panel, because I stopped after 6 weeks, tried again a few months later, and learned a lot about what makes my body feel better. So we're excited to talk about that today.
Hello, you guys know who I am, but I'm Bariatric Bro. I had surgery 5.5 years ago, and I started tirzepatide for my tummy tuck for 3 months, and I lost 34 pounds.
Okay, so some people here don't know what GLP1s are. What are these letters? What are these meds everyone's talking about? These skinny shots, all the celebrities are taking them, right? So GLP1s, they're a family of drugs. They're very, very new. So they've only been around for about 2 years. They were originally diabetes medicines, and then it's interesting, they actually developed from the saliva of a Gila monster, which is crazy. That's like a dinosaur looking thing. But long story short, it was used as a diabetes medication, and then we had the strange finding that people were losing weight. So it was rebranded, reformulated into specific medications for diabetics or weight loss. So you have semaglutide, that's like acetaminophen and Tylenol. That is the actual generic drug name. And that branches to Ozempic and Wegovy. Ozempic's for diabetics, Wegovy's for weight loss. Okay? Then you have the newer drug called tirzepatide. There's 2 versions of tirzepatide. There's Mounjaro for diabetics and new Zepbound for obesity. Here's the challenge. I already talked about the diabetes and weight loss indications. But just because you're a candidate does not mean you can get these meds. So that's up to your insurance. These meds happen to be extremely expensive. So coverage is very limited. In Southern California, the coverage is somewhere around 10% of my patients actually have coverage for these meds. And these meds are extremely expensive. They're between $1,000 and $1,500 a month retail at the pharmacy. So you may hear about this thing called compounded semaglutide, compounded. So what month retail at the pharmacy. So you may hear about this thing called compounded semaglutide, compounded. So what does that mean? That means that when a drug is on the FDA approved shortage list, a compounding pharmacy has permission to create these drugs in their labs. So in an effort to make sure that patients get these medications, these compounding pharmacies are creating them. And that's another way to get them to patients. I both do retail versions and compounded versions of these medications, so you're going to hear about the story. I took care of Chris, and we have a ton of very successful patients on these drugs. They have fit perfectly into our practice, and the reason is these drugs are hormonal. This is the first generation of weight loss medication that is hormonal, and not just a stimulant or appetite suppressant like phentermine, which is basically an amphetamine. So they're working very similarly to bariatric surgery, although not as effectively. So bariatric surgery likely changes 20 plus hormones. These medications, semaglutide alters GLP1, which is 1 hormone. And then you have tirzepatide, which is slightly newer, alters 2 hormones, GLP1 and GIP. So that's a general primer for this. I'd like to open it up to our panel so we could talk about individual stories, and then as questions come up, write them down, put them in your phone. We're going to open it up to all of you. I have pre-prepared questions. If it gets quiet here, I don't want to use them, okay? So this is all for you. So let's go ahead and get started. Janae?
So the reason why I started taking a GLP-1, to be honest, I just wanted to lose more weight. So after my weight loss surgery, I dropped 60 pounds pretty quickly in the first 6 months. And then I hit the 180s and I stalled out for 6 months. And not only that, the food noise came back. If you're like me, I have a very healthy appetite after weight loss surgery, very normal. I'm not a 3-bite baddie. I eat all of my food, all the time. And so I was scared about that. I'm like, I'm working out, I'm eating right, I'm doing all the things that I did before surgery, because as we all know, everybody thinks, you know, you're just eating, you're not working out. No, I was doing all the things before, and I'm doing it after, and I started to feel hopeless again in my body, even after surgery. And so I did the phentermine before surgery. I tried Contrave, it's a weight loss pill. It made me sick. And Chris actually is the one who told me about GLP-1, his journey, and I'm like, I need something. And so I started taking the compound version of semaglutide in April, and instantly it killed the food noise. Again, I have a healthy appetite, so no food suppression for me here. But I felt in control again, and I started to lose weight again, and it started to, again, heal my relationship with food and my body and just diet culture in general. And so it's a life-changing drug for me, but like all of you in this room, I don't know the long-term effects of it, especially in a weight loss surgery patient. So I'm even scared about what do I do next? Do I stay on this? Do I keep, like, what is next? So I'm probably like all of you.
Yeah, hi. So like I mentioned, I had weight loss surgery 3.5 years ago, and as many of you probably heard yesterday, I stopped drinking about 1.5 years ago in my journey. When I did that, counter to what you would think, I started regaining quite quickly. And I can see that that's because the neural pathway in my brain that wants to nurture at the end of the day was turning to alcohol for a while, and then whenever I stopped drinking, it toggled back to snacking. I have a diagnosed binge eating disorder, and it usually occurs at night. So I started regaining, and I regained about 30 pounds and turned to the GLP1s to see if that could stall the regain process, because the trend line was concerning to me, similar to what Janae just said. So I started the compound tirzepatide in January. I was on it for about 6 weeks, and I lost 13 pounds, but what I realized was I was losing it the wrong way. I just wasn't eating. I had no desire for food. And so I'd eat if I felt nauseous, but otherwise I wasn't bothering with it. And so I felt weak and dizzy and thought, clearly these drugs aren't for me, I feel like crud. So I went off of it for a while, and you would have gotten whiplash at how fast I regained those 13 pounds that I lost. And so I want to say a couple of months ago, I restarted the compound tirzepatide, knowing that it was more than likely the fact that I was starving myself that was causing the dizziness and the other issues. And sure enough, I started treating food more like a medication. Like, I'm gonna eat my yogurt at this time, I'm gonna eat my turkey at this time, and really force feed myself, whether I have a desire to eat or not, healthy things that make my body feel good. And it's been really successful for me. I'm losing slowly. I actually spread my injections out a little bit further than the prescription, just because that's how my body feels good. And it's been great. I've lost that 30 pounds that I regained, and I'm happy with where my body is. So. That's awesome. Oh my God, thanks.
For me, I was at a place, I had a number that was stuck in my head, and I wasn't under that number for some reason. And although I felt good, I looked good, I was in the gym every single day, 211 and 212 and 213 just bothered me that I was over 200 pounds. So just before I decided to go on my plastics journey, I tried everything, tried to reset my pouch and do all the things, and just drink water and, again, the water, the protein, do all the things, and I still stayed at that number. So of course I called Dr. Russo, and the first week I was on it, I lost 11 pounds. So of course I called Dr. Russo, and the first week I was on it, I lost 11 pounds. So of course I called Dr. Russo, and the first week I was on it, I lost 11 pounds. So of course I called Dr. Russo, and the first week I was on it, I lost 11 pounds. The second week I lost 4 pounds, and then after that I think I lost another, because I lost a total of 34 pounds. But for me, while I was on it, I wasn't hungry at all whatsoever. Like, I knew that I had to eat to survive, but it worked, and it did the things that it was supposed to do for me, and I loved it, and I would recommend it to anybody that wants to try this journey.
That's great. I mean, even just going through the stories of these 3 patients, a million questions popped into my mind. There are so many things to touch on here, and you all kind of went to the same place a few times, so I have a feeling that we're going to be asked about that. How many people in the audience are either on GLP-1s, if you want to share, considering them, or have taken them? Yeah, and that's why I asked that question, because it is so prevalent. There are so many people on these meds that it's like scary, especially where they're getting them from. And you hear journeys like Stephanie's, that's a pure function, that first time she was on it, of not having the right medical care attached to it. She didn't know how to use these meds most effectively, because they work. They will stop your appetite, they will curb it all. I tell my patients, it's kind of like you got bariatric surgery again. So expect that. And I often tell them, you cannot depend on your body to tell you that it's hungry anymore. Just like bariatric surgery, I say you treat your body like a garden. You give it what it needs, whether it's asking for it or not. And that's the way to make sure you don't starve yourself. Because contrary to popular belief, if you starve yourself, you will not lose weight. Your body has a mechanism that will hold your weight, and it will not allow you to lose weight unless you get that protein and nutrition in. Then it lets it go. But does anyone have questions that we want to get started? Yeah, so we're going to be busy. All right, yes?
So I've kind of started looking into different programs just because online they're pushing it, like curves and all these other like crazy things. And if you get to the fine print, sometimes says you have to live in certain states in order to be able to take them or have them be able to give them to you. So what's going on with compounding, or what? I mean, should you be looking at for something specific? What really should we be looking at when you look into a program?
I'm going to say something really quick, and then you guys can just chime in. So whether or not you can receive a compounded drug in your state depends on, and I became an expert in all this, your state's laws, and the State Board of Pharmacy with that specific compounding pharmacy, whether they have a license. The compounding pharmacy needs to have a license to send it into the state where you reside. So that's where that comes from.
So I'll speak to this in the capacity of my other life, which is my marketing career, in that I have some clients that are in this space as well. And what we're finding is that there are platforms that are making it really, really easy for anybody to create a business selling GLP-1s, right? It's essentially a WordPress for these GLP-1 drugs. So you're going to see all kinds of folks popping out of the woodwork that are offering these drugs. My recommendation would be to go to your bariatric practice first. Yes. Talk to your doctor. Now, I absolutely recognize that a lot of the hospital systems that we go through are not offering the compounds because there's fears around that. So if you're in the situation like I am, where my insurance does not cover the name brand, my hospital does not cover the compound, that's where I turned to one of the, I don't know what to, one of the randos to get access to the medication. I just did research on the compounding pharmacy to make sure that there were no adverse effects of other patients that have gone through there, because they decide what goes into it. Now, correct me if I'm wrong, Russo, but what I've heard is what they're often doing in the compound pharmacies is taking the purest version of the drug that there is and then adding things like B12 or other things so that it's not, going to violate the intellectual property. But so making sure that you don't have something wonky in yours is important as well.
So with regard to that, that's kind of true. So you'll see them combining it with B12, glycine, other formulations, and they can document that that's controlled nausea or this or that. But you can actually create, while it's on the shortage list, you can actually create the actual drug, just clean drug, during that time. Now we're in a weird position now where tirzepatide, they're trying to pull it off the shortage list. There's a huge thing that's going on right now. The Board of Compounding Pharmacies has actually sued the FDA for making that decision. There's some crazy stuff going down. I've got a team of lawyers that go down to DC. Like, this is real big deal because the amount of limitation to access is scary. Because if that happens, all patients that are on it, they won't be able to get it from anywhere other than retail. So there's a lot of dynamics kind of in the legal paperwork, bureaucracy, which I'm not interested in.
Are there pre-existing conditions that should be considered when you're thinking about GLP-1s?
Contraindications? Do you guys want to touch this?
You sound like you're the doctor, man.
Okay, so these are very, very safe drugs. They're not stimulants, so they're safe on the heart, the lungs. There are a couple of red flags, though. Number one is a family history, not of just cancer, it's not of just thyroid cancer, medullary thyroid cancer, or MEN2 syndrome. Medullary thyroid cancer is only 1 to 2% of all thyroid cancers. So just because you have thyroid cancer in the family does not mean you can't have these drugs. You need to find out specifically what type of cancer it is, because 98% chance you're still good. The other thing is, remember, these are diabetes meds. So there is a small risk of hypoglycemia, so you've just got to watch your blood sugar. The interesting thing about these meds, though, is for non-diabetics, it doesn't seem to push people into hypoglycemia. Yeah.
Back to before we were starting to take questions, you were saying that like all the things that the meds do, that you have to make sure that you're eating and that kind of thing, which isn't that really similar to what people experience right after they have surgery, right? Isn't that like, you know, one of the advantages that people take these meds, you know, a while into their, isn't that like, you know, one of the advantages that people take these meds, you know, a while into their, you know, thing is maybe coming back, and now this would help you. Is that?
That is exactly right. Did you all? How many of you are bariatric surgery patients? All three of you. Okay. Yeah. So, did you feel that the meds made you feel almost like you had surgery again?
100%.
Yeah.
100%.
And that's what we hear. And here's the reason why.
reset.
Why do you think bariatric surgery works? Is it because your stomach's smaller? No, actually. Yes, we're changing the digestion, but it's not just because we're moving calories faster with a bypass, for instance. That is not the reason for weight loss. It's all hormonal. So it changes your body's metabolic hormones, and we don't even fully understand all of the body's metabolic hormones. But like I said, bariatric surgery is flipping switches on you, which is why you feel so dramatically different. Like, for instance, the hunger hormone, which you all hear knocking on your door all the time, is ghrelin. So patients that carry an extreme amount of excess weight have 5 to 6 times the secretion of ghrelin of a normal individual. After bariatric surgery, it drops below normal levels, and then slowly over a year, it creeps back to normal, which is why you have this weight loss steep curve, and then you plateau out around a year. That is how it works. So these GLP-1s, very similar. GLP-1, you're deactivating GLP-1, which has a very strong control on the hunger center in the brain, also the satiety center in the stomach, are making you feel full, which is where that all comes from. Where's the mic?
Mine's like a two-part question. So I did try a GLP-1.
Can't hear you.
I did try a GLP-1, and it made me so sick. Are there different ones that will not make you sick? And is it really true that after you stop taking them and the food noise is done and you've lost the weight, that it's going to come back again?
Yeah, I can speak to that a little bit. I felt the same way when I first started the tirzepatide compound. I felt horribly nauseous. For anybody in here who's been pregnant and in that first trimester where if you don't eat, you feel like you're gonna barf, and then you can't eat because you feel like you're gonna barf, that's the experience that I had the first time around. That faded for for me, and I know it's going to be individual for everybody, that faded for me after the first few weeks, the second time around, whenever I was essentially force-feeding myself protein to make sure that I was getting enough calories. I do find that if I don't eat, my first indicator is dizziness. I'll be like, oh gosh, I'm like, whoopsie daisy, there we go again. So it's something that I have to be really careful with, but I wanted to answer Beth's question too about the, feeling like you're just post-op again. To your point, just post-op, food did not make me feel very good. And there are 3 real things that I noticed the difference of on the GLP-1 that are the same as surgery. It's the food noise goes away, which is the weirdest thing, because then it comes back about a year after surgery, or it did for me at least. There's the hunger component of it, I just don't have as much. And then there's the restriction. It feels like it's much more restrictive in there. Like I cannot get as much of the slider foods down. So it hits all 3 of those, whereas I have been on phentermine or Vyvanse before, and that's really just a stimulant and an appetite suppressant. It's not doing any of those other pieces.
And when it comes to taking a GLP-1, if you haven't taken one already, I would definitely not be worried as far as the side effects are concerned when you're listening to other people's experiences. So for me, when it comes to weight loss surgery, I was tuning into everybody's experience. I thought I was gonna be sick, nauseous, I was prepared for the worst, and I'm the absolute opposite. I was questioning if my surgeon even did their job because I never experienced anything that anyone goes through. I've never experienced it. And it's the same thing with GLP-1 for me. Like I was prepared for all of this stuff to happen. Nothing has ever happened to me, and I could just be a lucky person, but a lot of people don't talk about that, like just being normal. And so if you're thinking about taking a GLP-1, yes, take in as much information as you can, but just know that you may not experience that stuff, and it's okay.
Yeah, so a couple things come to mind. Number 1, the mechanism of action is what causes these symptoms. So obviously the hunger suppression, you're not gonna have that trigger that says, hey dummy, you're hungry or thirsty. No, you need to go seek it out yourself. You need to know that you're gonna have 3 meals, 3 snacks a day and stay well hydrated. And that food noise that's suppressed is very, very interesting. There's a lot of studies going on that what we describe as food noise, it's almost like the reward or compulsion or addiction center in the brain, because these medications are actually improving things, and it's being studied now, like alcoholism, gambling, other types of addictive behaviors, because it's this pleasure reward center that's shut down. So that's part of the mechanism of action of the drug. Also, it's important to know what symptoms to expect, and almost all symptoms are GI related. The medication slows the stomach, so it makes the stomach lazy. Normally the stomach should be pushing things through, instead it just kind of sits there like a sack. So that can make you kind of feel full. You can even get acid reflux and things. But also the GI symptoms could be manifesting because you're not taking good care of yourself. The single most common symptom associated with dehydration, lightheadedness and nausea. And so if you're not hydrated, if you're not well nourished, if you're not getting your protein, you're gonna feel nauseated. And that's a slippery slope, because the more nauseated you are, the less you eat and drink, and then the more dehydrated you get. That's where people end up in the hospital with pancreatitis. You may see the pancreatitis associated with these meds is because of dehydration primarily. But I did want to touch on that. Is there anything you can do about managing symptoms? So that's one of the reasons to do compounded. As a compounded doctor, I can modify dosing regimens. I could go up more gently instead of really drastic with patients. I could fine tune it. But also, tirzepatide, which is a slightly newer drug, has less GI side effects. So if you were feeling side effects on semaglutide, it might be worthwhile trying Terz.
So I'm on tirzepatide at 10.5, and I had an endocrinologist. Can you hear me?
Yeah.
I had a doctor. I was on 2.5, 5, 7.5, now 10.5 each month going up. And I had a doctor tell me, oh no, you're going up way too quickly. And this was a couple weeks ago, and that kind of scared me a bit, so I wanted to ask about protocol, and if it really is different, person to person. This doctor also told me, remember, when you go off of it, you will gain all of it back. So I'm cautionary asking. But is that too quickly, dosage-wise, to go up, or does it really just depend on the person?
No, that is the exact labeling of the drug. Month 1, 2.5, month 2, 5, month 3, 7.5, month 4, 10. That's how it works. Should you go up faster than that? No, that's too fast, right? But I have many patients that go up slower than that because we're treating to effect. So as long as someone feels suppressed and they're losing weight, we stick with it. Why push them? If they're not having any symptoms or they start to feel hunger a little bit more, then we up them. It's not just an on-off switch. It's like a toggle lever. You like go harder, then you bring it back. That's the way to do these meds for sure.
So I had my surgery in May of 2018, and GLP1s were even a thing until recently. So I started taking Ozempic. Over here, and I take 0.25. I've only just done 0.25. If I go up, it makes me, I already barf as it is, so it makes me barf more. So my question to you is, I now have a pooch, a baby belly that never had a baby, and I hear that that's a side effect, and how do I make that go away? And is that from your experience?
Okay, so just to touch on your dosing, that's also important to know. Some people are super responders and they only need a little touch of these meds to get an effect. Other people are non-responders. In fact, 10 to 15% of people that are on these meds do not respond. They do not lose weight, they do not feel suppressed. So that could be a possibility too. With regard to the belly you're speaking of, congratulations, that's what happens when you lose weight. Yeah, what you're feeling is you're losing the fat, so now you're left with the excess skin because you could lose fat, you can't lose skin. So other kind of modalities like wearing tighter fitting undergarments, doing things like skin tightening procedures, skin removal are the only reliable way to really get rid of that. Yeah.
Nice tummy tuck. I'm a good doctor.
So I take Ozempic also, but you said before Ozempic is for diabetes and Wegovy is for weight loss. Is there an actual difference or?
They are the exact same drug, exact same. They're both semaglutide, just like the TERS. With TERS, the dosing is the same for Zepbound and Mounjaro. There are slight differences in dosing, the per month dosing, and you could go up slightly higher on Wegovy to 2.4.
Hi, my name's Renee.
Hi, Renee. Hi, Renee.
Hi, Renee. So I'm currently taking semaglutide, and they started me on like 0.25 and then 0.5, and we went up. Now I'm at like, I don't know, 2.5 or something. And I'm ready to go off of it. I'm ready to come off of it and go on to like maintenance or whatever. And I'm curious, is there a reason to go lower on semaglutide or go to the T one, the trazodone? Yeah, would you recommend staying on semaglutide and weaning off or changing drugs?
Do you plan on losing more weight?
I would like to lose a little bit though, yes.
Yeah, so you're essentially maxed out on sema. So if you plateaued out, you're probably seeing the last of your sema effectiveness. It's reasonable to switch to TERS. What you need to understand though is that these drugs, although they're like cousins, they're different. So if you switch to TERS, you have to start at that month 1 dose and build yourself back up again. So people can have a tiny bit of weight rebounding then. So you have to be really careful. And in terms of coming off the drugs, I wean in my practice. We typically come down in dose once someone's reached their goal weight, see how they do, and then we go to bi-weekly dosing and then come off.
And is it also true that once you start to wean off, you can still continue to lose weight?
Yes.
And it's easier to come off and not regain rather than just like shut it off?
Yes, 100%. If you just go cold turkey, especially if you didn't really adopt the lifestyle changes of high protein, low carb, you didn't build that regimen, you're at very high risk of weight regain.
Can you talk about muscle loss and and the GLP1s. So I've been thinking about going on a GLP1 for the head noise, but I've also been spending more time in the gym to try to focus on strength training. And I've heard a lot about like Ozempic face and losing a lot of the muscle mass and just not focusing on fat loss. Can you talk about that?
He stayed really good.
Yeah, muscle over here. Yeah.
So for me, I don't feel like I lost muscle mass. I lost the extra excess weight. But for me, I think it also gave me an extra energy in the gym as well. I stopped taking pre-workout while I was on it, so it just gave me that extra boost for those 3 months that I was on it. So, and
But you kept going to the gym and you were eating your protein.
yeah, but I went to the gym 6 days a week too. So I guess that may be different for me.
Yeah.
That's how you
You're
maintain
an
it.
overachiever. From an underachiever, I will say that it does make it harder to get as much protein in, which made it harder for me to work out. It made it harder for me to have the oomph to get myself to go work out. So it, especially in the beginning, but you know, you said it before, as long as you're changing those habits and making sure you're doing the stuff, the reason people are losing muscle mass is because they're not working out and they're not eating as much. And so if you're monitoring those two things, then you'll be okay. It's just at a macro level, people are losing muscle mass because they're not adopting the changes. And in large part, like Russo said, because they're able to get these drugs from people, from sources that are not combining that with you know, fitness and nutrition training and things like that. And I'll be honest, I feel fairly well educated when it comes to a bariatric lifestyle. But being 3 years out and you know, slipping back into some old habits is just very easy to do. So you really have to treat it with that obsession that we all had at the beginning of bariatric surgery as well.
Protein.
And for me, someone who's not a 3-bite baddie, I eat all my protein, and I run a lot and I do weight training. I look at the GLP-1 just like weight loss surgery. You're dropping the weight still, you're probably gonna be dropping that muscle and the fat. And so prioritize your strength training, prioritize eating your protein. Look at it like you did weight loss surgery. It's not something that's completely different just because you're taking the GLP-1 now. And if you are worried about dropping muscle mass, I would tell you to go to the bodybuilding panel. We have our muscle mommy here today that's going to be talking on that. And so you can get more information on prioritizing your strength training. But I wouldn't worry too much about it.
The exact same rules apply. I manage my GLP-1 patients the exact same way I manage my bariatric surgery patients. Yep.
Good morning. Hello. I think I have a compound question or two. I don't know. So I found that 5 on tirzepatide was where my life was beautiful, but that provider was trash, and so it was like medical neglect. I can't go back there. And I have found it incredibly difficult to find a reasonably priced tirzepatide off the market from like a 503B pharmacy. And those are 503A. I hear that's not what you need. And so I'm curious if going to semaglutide will give me the same head hunger effects or depression as tirzepatide. Here is the compound. While answering that, can you share more about what is this head hunger? People say it mimics feeling full, but in my bariatric surgery, I've always felt full and my brain has still said food, 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 which never happened on tirzepatide. So that's my compound question. Thank you.
Do you guys want to talk about 503?
No, you talk about that.
Okay, so if you're looking for, I'm not going to spend much time on this, but 503A and B, the main difference is 503Bs are mass producing, higher level of regulation, but they typically only sell to clinics. It's very, very hard, especially if you live in California, to find a reliable source from a 503B. They're mostly 503A. 503A are more of like the mom and pop compounding pharmacies. They're 75 to 80% of what you're going to see in the compounding market, and that's okay as long as they're holding themselves to high standards. There's still standards that they must meet to be licensed in the state that you reside But, I mean, if you're in California, I'll take care of you. I'm like Walter White, I've got the best stuff. Yeah, I got real into it.
He's saying
But-
yes, Matt.
Yeah. And the second part of your question, what was that?
The food noise.
Oh, yeah.
Yes, you
The-
talked about food
yeah,
noise.
so food noise,
Will the semaglutide, I can't find the semaglutide quality that I'm liking, so will moving to the semaglutide help with the head hunger in the same way?
yes, the mechanism is similar. The difference is you lose slightly more weight on TERS and has slightly less side effects.
What, I'm sorry, why is semaglutide more expensive then?
It's not.
It's
TERS is about twice the price.
So, especially on the compounds, there's a fairly fixed pricing structure for what the retailers are getting charged. And then, I'm just giving a lot of inside baseball on these like platforms that are popping up, but the retailer decides how much margin they're going to add to it. So that's where some of the research should really come in is, if you're looking for something affordable, there are a lot of options out there. Again, I'm gonna keep saying, refer back to your bariatric clinic, refer back to your doctor first. Those are gonna be your safest bets. But somebody else mentioned that it is also state specific. They can't often ship them out of state. That being said, Google Ads knows what state you're in. So if you're searching for this stuff, you should be getting presented with options that are available to you locally. On the food noise front, I wanted to answer your question. I'm not on a semaglutide, but there is new research coming out about the GLP1s actually being implemented for opiate addictions as well, because exactly what Russo said, it treats that dopamine need. And as an ADHD person, I recognize when I'm seeking dopamine. I'm like, I want a bath or go for a walk. I'm like, oh God, I must just need dopamine right now. So it's treating that compulsive need. And so both of them, I believe, do that in the same way.
I'm also on semaglutide compounding, so I wanted to comment on what she had to say about the fullness or hunger noise or whatever. For me, it didn't kick until I reached max dose. So once I got to 2.5, it was like a desert in my brain. It was so interesting to not have to even think about the things that I bought and forgot about it. It was manageable. So, and obviously everyone's experiences are different, but that was mine. But my question is about GLP1s and being at maintenance and what that looks like, because I had bypass and I just started to gain when I felt like I was doing everything right. So I went into my clinic, cried my eyes out, and then went on the compounding semaglutide, which has been really great. And I'm scared to death to reach maintenance and then to stop. And so I know it's only 2 years old, but thoughts about long-term use, or should I go down on dosing so then that way I'm at a lower dose because I've reached my weight? That's my question, I think.
Okay, it's going to be asked. I'm sure it's in a lot of people's minds. Can you stay on this thing forever? Yeah, you can. Basically, the research that we're seeing so far, these drugs were designed for long-term use. They're designed to be used like diabetes drugs or high blood pressure meds. So you can stay on them. Do you have to stay on them forever? No.
Well, my obesity is a bitch, and I think I'm gonna have to.
I mean, everyone's is. I get it. The hormonal effect, and you could thank your parents for your genetics. And yeah, I mean, it is what it is. You just don't have the luxury of not caring what you're going to eat. Your body will respond. It's like an addict having heroin is a previously obese or currently obese patient having carbohydrates, processed and refined carbs. It's just the body just likes it, and it turns up the thermostat, says more, and that's where the head hunger is kind of coming from. But that's also why it seems to spill over into other addictive behaviors, because it's very, very similar. And we've known this for a long time in bariatric surgery because we see it. We deal with these patients all the time. But please understand that obesity research is very, very young. We're just now understanding the hormonal basis of obesity. So we used to think that bariatric surgery was just making people's stomachs smaller, but no, it's not that at all.
So is there a maintenance dose that's best? Like, can I?
Everyone's
down?
different.
Does that not matter?
You would stay on a dose where you're able to maintain your weight.
Okay.
That's maintenance, and that's okay. Or you can wean off. We wean off in my practice. We go down in dose before we start spreading it out, because these drugs have a really good timer kind of built into them. By week 2, you're feeling different. Week 2, you could tell your body's waking back up. So. Yeah, like at the end of week 1, you're like, oh yeah, I'm due. No, that's how they work. So that's why I always say go down in dose before you start spreading them out.
Thank you.
Sure.
Hello everybody, so I am a patient of Dr. Russo's, and I attribute so much of my being able to have Micheal to Dr. Russo, and he really worked with me, and I was on semaglutide for 4 months, and it was the behaviors that, you know, I took being on semaglutide, plus I think my thyroid medication that really regulated my TSH levels. My TSH levels today are still the same that they were when I was on semaglutide. I still have the same behaviors from semaglutide. I had a really healthy pregnancy with Micheal. I gained 20 pounds. I feel great this time around. I, was trying to game plan with Dr. Russo this summer on, hey, when should I get back onto the weight loss meds so that I can have another baby? And then boom, I ended up just not even needing them. Here we are. But I want to talk about, kind of what we were talking about. When is it safe to start semaglutide after having a baby?
Okay, so I want to touch on semaglutide during pregnancy first. So it was only seen in rats. There were issues in rats with pregnancy, so it's technically as a pregnancy black box, but it's only because we don't know that it's safe in pregnancy. It's not for sure unsafe, but we don't know if it's safe. Same thing applies if you're breastfeeding. Just because we don't know, it's best just to not do it. Once you're no longer breastfeeding, you're good to go.
Hi, so I'm on the tirzepatide. I take the Zepbound, and the very first dose was really, like, I'm only on 5, and I'm actually thinking about going down because I'm dizzy. Like right now, I'm like, oh, I didn't eat today. Hold on. So my question is though, you can stay on them forever. So that food noise, I mean, all the noise is gone. Like even shopping. Like it would be like I'd eat a lot, or then I'd go to Amazon. One or the other, right? So it takes all of that away. So I don't want to go off of it because I really feel like it's helping in other areas as well. So you can just take it forever?
Yes. We just got our 5-minute warning, so we're going to be speeding up.
Yeah.
Because I want everyone to kind of get questions answered.
Hi, I'm Erica.
And by the way, we'll be up front afterwards. I'll hang out. Yeah. I'll be somewhere you can find me.
None of us are hungry for lunch,
yeah.
so you're
I have a question. Hi, I'm Erica. I live locally in Oceanside. I used to live in Orange County, just moved back to San Diego. But I'm on the Mounjaro. This is my 2nd month on it. I have hypothyroidism, PCOS, had the bypass in 2020, and gained some weight. But I like the Mounjaro. But my question is I thought about maybe doing a revision versus the Mounjaro, and I'm wondering if, because I like the medication, but I'm wondering if staying on this is better or doing a revision, to the bypass could be helpful too for long term.
They could both be helpful. We do a lot of revision surgery. The next step would be, not everyone's a candidate for a revision. So the next thing would be speak to your bariatric surgeon or come see me. We'll get a special x-ray and measure your pouch and the stoma, which is the opening between your pouch and bowels. If it's stretched out, you're potentially a candidate. But both would be helpful.
We're not located in Orange County.
Yeah.
Can I ask a backup to that? If GLP1s aren't working for, I've been on both. It's not that I didn't lose weight, I stopped gaining, so that's the way it worked for me. Should I then go the revision route, or is there somewhere else to maybe go?
If you've already tried both meds, you've been managed by someone that knows what they're doing, you maxed out potentially on both, you didn't tolerate either one, revision is the only other reliable way to get significant weight off. Don't think you're going to lose it with diet and exercise. For the same reasons that you needed bariatric surgery, you're going to need some sort of tool to help you hormonally.
Thanks to maintenance, because the question of maintenance has been coming up quite a bit, and I want to speak to how it has worked for me, at least. I'm on the 25 units or 0.25 of tirzepatide. I think I might do one of those I've never gone up. Wherever I started is where I've been. But what I found is now that I'm to a place where I don't actively care to lose more weight, I'm spreading out my dosage because I'm at the lowest that they prescribe, but essentially I'll put my date as Tuesday as when I'm going to take my weekly doses, but if by Tuesday I'm still not feeling any hunger triggers, I'll spread that out a few more days. I'm scared to say that on stage with the doctor because they're like, follow your doctor's prescription. But it's been helpful for me in a way of tapering out that complete lack of hunger when I'm to a phase. And I just monitor my weight. So if the trend line starts going up again, then I'll start following my prescription again.
That's okay. You can't go down anymore. I mean, you know your body, but the truth is you can't go down anymore, so it's time to, that's how you wean off. You spread it out. Yep.
I have a question. Is this safe for people without gallbladder?
Yes.
And what about,
What about if they have what about gallstones?
Yes.
and what about people on the lower end of normal fasting blood glucose?
Yes. Monitor your blood glucose though, because it could rarely cause hypoglycemia.
Yeah, one more question. Get your lunch after this.
Hi, my question is related to the question regarding muscle loss on the GLP1s. I'm a trainer, and so I work with a lot of people who have had bariatric surgeries, who've experienced a lot of different symptoms as side effects, and so my goal in my work is to make sure that we're focused on building as much muscle as we can or preserving what they have. So my question is related to PCOS. So I have a client who completely stopped working out for a while as they went on these medications and has seen muscle gain on these medications without working out. And so I'm interested in, is there a hormonal impact with the GLP1s if they have excess testosterone that would cause them to gain muscle? We're doing like in-body body composition analysis to monitor trends with all these clients. It's actually really interesting.
So if lean muscle mass is going up without working out, that's an anomaly. Normally you need to have protein intake, you need to be working out.
You have to have a stimulus.
Yep. Well, that's everything.
All right, that was it.
Well, thank you all. I hope you all enjoyed the presentation. So we're all going to be around the conference. Please continue asking questions. I love answering questions. We've got a booth in the other room, so stop by.
Thank you guys for joining. We're gonna go eat lunch now. Love you guys. Bye.
You guys want to